1 LP, but I will modify it. 1 LP, 2 LD, B adds V, okay, 1 LP, 2 LD, B adds V, okay, then is the 3 is D, okay, 4 is more. Okay, so even if you forget that, okay, so first familiar dyslipidemia is hyperchylomicronemia. Okay, so mnemonic is 1 LP. Okay, in LP you can clearly see that the actually so how question will be made from this topic. Okay, clinical feature will be given and then examiner will ask which enzyme is deficient. So that is the question. So whenever in biochemistry, remember, whenever examiner is giving you some pathology, examiner will ask enzyme deficiency. The examiner will ask some, we can say, physiology. Okay, so when a question will be given upon hyperchylomicronemia, okay, these features will be given, and then examiner asks, okay, which enzyme is deficient. So that is the point. How you can cover that? 1LP. It is ending on P, so the mnemonic is 3P here. Okay, so first we cover this enzyme with this LP. So one is LP. LP is lipoprotein lipase. Okay, R is deficiency of FOC2 deficiency. So remember this lipoprotein lipase. Okay, this enzyme is high. Okay, next move towards these clinical features. So here I am making mnemonic with 3P. First P is pancreatitis. Okay, second P is I have just covered this one, splenomegaly. I can say hepatosplenomegaly. Third P is pruritic xanthoma. Both are these words have sound of 3P. Okay, so in first mnemonic is LP. Okay, you are having 3P. Pancreatitis, one. Second is splenomegaly, I can say it's hepatosplenomegaly. That's it. And third P is pruritic xanthomas. Okay, remember, in this case, there is no increased risk of atherosclerosis, and due to high level of chylomicron, okay, you will have creamy layer on supernatant. Whenever you take a blood, okay, you took the blood and stand for 3 to 5 minutes, what will happen in the blood? Upper level chylomicron will make a creamy layer, like if you are Punjabi, you have to लस्सी, okay, on लस्सी, okay, आपके लस्सी जब लेते हो मक्खन बनता है ऊपर मक्खन बन जाता है. So just like that, you are having creamy layer in the blood sample. So first is covered. We have done the hyperchylomicronemia. Okay, first mnemonic is covered. Then second is the 2LD and B adds V. Okay, so here is 2LD and B adds V. In this case, the 2LD. In this case, you will have deficiency of LDL receptor, or you have deficiency of defective FOB100. Actually, that is a part of cholesterol. Okay, so that is mnemonic 2LD. And third one that is not mentioned here, but has been asked in NDME. Okay, that is the if we have studied the cholesterol, LDL, okay, LDL receptor, HDL, okay, chylomicron, we have studied, okay, in LDL there is an enzyme PCSK9. Okay, actually that enzyme normally break down the LDL receptor, normally break down the LDL receptor. Then there will be issue with this enzyme. Okay, hyperactivity of this enzyme. Guys, remember, this point is not given in the book, even in the, you can say, I think it's not mentioned like even in the U word, but it's important because topic is given. Your examiner not bound to your first aid, not bound to your U word. So remember, okay, so there are three issues. There are three pathogenesis with hypercholesterolemia: absent LDL receptor, defective FOB100, and third, here you can clearly see both are deficient, but this enzyme level, the PCSK9 activity is increased. It's strange. Examiner can confuse you here. Okay, so PCSK9 is like a LDL cutter. Suppose this is, so I'm just trying to suppose this is a receptor, this is not a receptor. Okay, just kidding. Okay, suppose this is the LDL receptor. Then is the that is PCSK9. Normally PCSK9, okay, cut those receptors. Okay, but if this enzyme PCSK9 activity is increased, what will happen? More LDL will be destroyed. More LDL will be, you can say internalized. Okay, so when PCSK9 activity is raised, what will happen? LDL receptor activity will decrease. So result is same. You will have hypercholesterolemia. Okay, there are two forms. Heterogeneous as okay, in this case, the cholesterol level will be mild, but in homozygous, okay, means both mutation, actually both genes are mutated. Okay, in this case, very rare, but cholesterol will be high. So in this case, mnemonic is 3A, 3P to 3A. Okay, okay. Well, 3A, first A is accelerated atherosclerosis. Okay, you can have MI before age 20. Remember, normally MI occur in males after 45, after 40. But if you have seen MI in before age 20, actually nowadays it is okay. It's becoming common to have MI in early age. Okay, so if you have MI before age 20, this is very high risk point. Remember that. Okay, it can be hypercholesterolemia. Always, whenever, so here is MCUs. Okay, whenever a patient have MI in early age, you can check your fasting lipid level. Remember, guys, when you are ordering lipid level, you will always use fasting lipid level. Okay, next A is the Achilles xanthoma. Okay, Achilles tendon. Okay, there will be fatty deposition of the Achilles tendon. Third A is the orcus. Also, you can say corneal orcus. Always make differentiation. There is also age-related, okay, deposition of fat, okay, in the eye. Okay, that is different type of, okay, you can say deposition. But here is corneal orcus. Okay, you have to make differentiation between age-related fat deposition and this disease-related fat deposition. So we have covered mnemonic is 3A. Okay, just I'm giving you 2 or 3 seconds to memorize this. Then we move forward. Okay, so we have covered 3P and then 3A. Okay, then move towards the next two one. Okay, next is the okay, three is more. Next mnemonic is three is more. Okay, so 1 LP, 2 LD, okay, 3 is more. Okay, so 3 is more. Here you will have this beta lipoproteinemia. Here you will have issue with the, you can say, FOE. So how you can cram that? I have remembered just 3. I'm just reversing the 3 with E. We are done. Okay, 3, I'm just reversing the 3 with E. You can clearly see that that is FOE. And then 3 is more. 3 is more. Actually, in this, there is more production of VLDL. Here, how you can memorize this, that you can clearly see that in this hearing part, I have just missed the one point. So 2LD, B and Z. So there are two parts, 2A and 2A, 2A and 2B. In 2A, you will have cholesterol level. Okay, but in 2B, you will have more level of VLDL. But in 3, you will have excess level of VLDL. That's why mnemonic is 1 LP. You can cram with me. 1 LP, 2 LD, B and Z. In B, you will have more level of VLDL. But 3 is more. In 3, you will have more level of VLDL. So we have covered that. Okay, 3 is more. So in this case, there's a mnemonic again, 2P. Okay, so premature atherosclerosis, same like here. Okay, again, you can have MI before the age 20, and you can have Palmer's and Thomas. Okay, so remember that. Mnemonic can be given in the previous edition. Mnemonic was given the air form. Okay, air form. The that mnemonic was also air. So by air, this is given echoing and form. Okay. Next, the last one, the most high need is the type 4, that is the hypertriglyceridemia. In this case, you will have more level of triglyceride. Okay, there will be hepatic overproduction of VLDL. So, same, the disease is telling you triglyceride, you will have more level of hyper, you will have more level of triglyceride. When it cross 1000, okay, it can cause okay, acute pancreatitis. How it can cause acute pancreatitis? Because every vessel towards the pancreas can be blocked, or the bile duct can block by triglyceride. Okay, mainly the vessel. Okay, a tiny vessel to the pancreas become blocked by high level of triglyceride. Then there is a ischemic necrosis of the pancreas, and then lipase become activated, and then you are having pancreatitis. Okay, and it is related to insulin resistance. This is high yield. Okay, very important. And here the treatment is so strange. Okay, it is not okay. Guys, remember the USMLE step one aspirants. Remember, never ever remember the drug of choice in USMLE step one. Even when I was preparing for USMLE step one, I will just say you just waste your time to remember. Okay, what is the treatment of choice? Hypertriglyceridemia. What is the treatment of choice for that pathology? Because these are the topic of USMLE step two CK. So just focus on the drug mechanism action. Just okay, for curiosity, I am what is the treatment of that disease? Okay, it is insulin. Normally, we think that insulin is used for diabetes, but it is not the case. Insulin can be used in three issues. Insulin can be used in, you can say, diabetic acidosis or diabetes. It is Everybody know, even the layman, uneducated people know I'm having diabetes, I'm on insulin. Okay, where insulin can be used under two disorders. Okay, first in acute hyperkalemia, insulin can be used. Second, hypertriglyceride induced pancreatitis. You can use an insulin because why when you use insulin? Because actually in hyperkalemia when you give the insulin, okay, insulin put, so here's the mnemonic, insulin put everything into the cell. So here I am setting the in the word. Insulin put potassium in the cell, okay, amino acid in the cell, glucose in the cell, then there is hyperkalemia, okay, when you give the insulin, potassium goes into the cell. Your hyperkalemia is treated. There are certain drugs, okay, some theta will be thinking, okay, you can use other drug, in hyperkalemia you can use calcium carbonate to protect the membrane. Okay, you can also use other, you can say potassium binding reasons to decrease the potassium, but they take some time. So even the drug of choice in the case of, you can say, in the case of acute hyperkalemia. Okay, and then in this case, in hypertriglyceridemia, when you give the insulin, insulin activates the lipoprotein lipase. Okay, activate that enzyme. So that enzyme break down the both. Remember that enzyme actually activates the lipoprotein lipase that we have discussed here in the first. Okay, it break down both chylomicron and trisulfide. So you can use the insulin in acute cases. So that's all. Next, I'm covering the next topic is the pericarditis. Okay, I will send another link to cover acid-base disorder. So, okay, next topic is okay. So, guys, I'm just repeating the whole point. One as V, two as V, B. Okay, one as B. Okay, two as D, B as V, three is E, four that's more like that. The mnemonic. Okay, I am also given mnemonic P, three B, three A, two P. So you can make a mnemonic. Okay, if you are Indian or Pakistani, you know the word pop. Okay, if you do pops, okay. So here three, two, okay, sorry, three, two. Okay, three P, then three A, then two P. We are done. Okay, so that's all about the hypertriglyceridemia. Okay, next topic. Okay, I wanna cover this topic, but we can't cover in 8 minutes. Okay, let me cover acute pericarditis. Then I will send another link to cover the acid-base disorder. If you are weak in that topic, please join the lecture because that topic is hygiene.